Actually, we have had a lot of issues regarding adoption, even before the, I'll call it epidemics of adopting students from school, because we've had a lot of problems where children are adopted from their neighborhoods, trafficked to other parts of the country. Though in my department, we have not received any students that were adopted from school per se, but we've received a lot of people that were adopted elsewhere and were brought to us, including children. And we have seen a lot of them present with different degrees of emotional problems, cognitive problems, and social problems. And some may include denial of the events, emotional numbness. Some will be mute, they won't even talk at all. The varying degree of depressive symptoms, which include feeling of hopelessness, feeling of helplessness, even when they are rescued, varying psychological symptoms of anxiety, which will include fearfulness, worrying, thoughts, and anticipation. They are agitated, restless, they have heightened sensitivity to noise, and a lot of other issues. They have all these problems and having trust and trusting other people. And some of them will even go extra length to be even wishing that they are dead, and they even blame themselves, even children.
When they come to you, what kind of help are you offering?
We try to control the immediate emotional problems. Then, when that is achieved, then there is a long-term cognitive therapy we offer, including treatment of diagnosed condition. If somebody has post-traumatic stress disorder, we target at long-term treatment. When somebody has major depression, we target at long-term treatment, and we assure them of the security for subsequent occurrence.
So far, what kind of results have you seen after offering the treatment and the counseling for these children?
Major problem is most of them lost to follow up. When you treat them, when you have like 2, 3 sessions with them, you hardly get them again. Sometimes you have to trace them. You place several passports, most of them don't come back again. Maybe probably because of the financial burden of traveling from where they are to the hospitals or to the place of arrangement. Some of them maybe the cost of purchasing medications if they are diagnosed with any clinical condition that needs treatment.
So there is no funding from the federal or state government for this kind of treatment?
Those that have been adopted in group from schools have some fundings, but those that have sporadic episodes of adoption hardly get any help from the government. If somebody has never experienced this type of situation or is not in the field to see these people or to feel their pain, he may hardly understand. This, I want to tell people that this is seriously devastating. Even to you managing these people, you have to hold on strongly. Sometimes you have to even excuse them, get out of the consultation, weep for these people, hold yourself and come back. It's really painful. It's really devastating. Sorry.
Doctor, do you have a sense that a section of Nigerians are living in fear? Do you have a
Yes.
sense that that is the likely scenario?
Seriously, including me. I live in the part of the country where this adoption is frequent, even though the state I live with is relatively secured, but to sleep every day with one eye open. And apart from that, when you are in a work environment or you are a working class, you have this serious fear that somebody is watching you and will likely adopt you someday. We are in constant fear, and we are not sure that the security is enough. So a lot of Nigerians are in this dilemma and frustration.